Hi, I'm Dr. Patrick, and I'm here to talk today about joint injections and talk you through the journey of a joint injection. So, the reason for having the joint injection is to minimise pain from whatever condition your clinician has diagnosed you with. This can be conditions such as osteoarthritis. However, there are some risks from having the injection. The main one, most significant, is the risk of infection, and this would be noticed by a red, swollen, more painful joint in the first 3 to 7 days after the injection. There can be damage to the surrounding structures of the joint as well, the tendons, nerves, muscles, and possibly bone effects and bruising. They're not that common, but just to be aware of, and especially if you're on blood thinners, the bruising's a one to be aware of. That would need some extra pressure after the injection perhaps, and to be aware of what your INR is if you're taking a tablet called warfarin. So for the injection itself, you enter the room, the clinician will put you in a certain position that they'd like you to be in, and for example, if I'm injecting the shoulder, I have the chair facing the wall in the corner with the joint exposed, and these things can be, the risks will be explained, and consent will be taken, and then the joint will be injected with the steroids and normally anaesthetic. So in the knee, you'd be sitting on a seat, and I normally approach the knee from the side, either on a seat or dangling over the end of the bed. There are other ways of doing it, such as lying flat, and the injections drawn up, inserted into the joint, and removed with some pressure, and then a plaster afterwards. After the injection, it's recommended to stay in the waiting area for 20 minutes so that you're okay. If you need any assistance, you can have a little bit of flushing, or some people have been known to faint, so staying in the building is probably a good idea. The rest of the day, it's important that you rest the joint as much as you possibly can, and you can have 2 or 3 joints in the year. The injection should infiltrate the joint and give some relief within the first 2 to 3 days, and then you can get maximal benefit over 2 months if you have approximately 2 months if you have a good result. And of course, any problems afterwards, you must report it, especially that risk of infection that needs to be treated as soon as there's any signs of infection, warmth, or extreme pain from it.